So we have in front of us 2015 November AIMS question. A 23 years old young boy with schizophrenia is well maintained on risperidone for the last 2 months. Okay, so this guy is well maintained. Okay, for the last 2 months. Now he has no family history of the disease. For how long should medication be continued in this patient? A. 5 years. B. 6 months. C. 2 years. D. It is 12 months. Now this is pretty interesting, and some people will call it as controversial question also, because it is not discretely mentioned or even decided that how long exactly for a young person who is having this kind of episode of schizophrenia should be maintained. But if we look at the overall evidence, whatever we have based on Morsley guidelines, NICE guidelines, and guidelines from all over various countries, the average answer, even including our own Indian guidelines, the International Psychiatric Society guidelines, overall answer would be 2 years. Okay, so 2 years would be our answer. Okay, so what's the explanation? So yes, so this is something that has to be highlighted. So let's see what is written in Ahuja. So a majority of the patients require maintenance treatment with antipsychotics to prevent relapse. Okay, so treatment is continued for 3 months to 1 year for the first episode, for 1 to 2 years for subsequent episodes, and indefinite period for the repeated episodes of persistent symptoms. Okay, this is what is written in Ahuja. But see, in CETP what is written. Okay, so although published guidelines do not make definitive recommendation, okay, this is what I was talking about the duration of maintenance treatment following the first episode. Recent data suggests that 1 to 2 years might not be adequate. So CTP talks even 1 to 2 years is not adequate. That means we might need to give them even more years. Generally recommended that multi-episode patients receive maintenance treatment for at least 5 years. Okay. Okay, so we had this option over here, by the way, of 5 years. Okay, but the uh, best option among all of these options is 2 years. Now here is the thing. Okay, so the current Ahuja's edition figure is strict. First episode is 6 months to 1 year, not 2 years. So 2 years is the figure Ahuja gives for subsequent episodes only. This is a thing to be kept in mind. Okay, so as per Ahuja's book, 2 years is only for subsequent episodes, not a first episode. The wider and more commonly examined teaching, that is echoed by Kaplan's 1 or 2 years might not be adequate, and implying 1 to 2 years is traditional minimum. Okay, it's a traditional minimum, treats at least 1 to 2 years as the standard first episode maintenance course, with 5 years or indefinite reserved for recurrent illnesses. Okay, so 2 years is therefore the best fit among the 4 options offered, sitting at the upper end of the standard first episode range. So remember, even though Ahuja talks about, okay, so Ahuja talks about 1 year, okay, but the standard, okay, so say CTP or other guidelines roughly talk about 2 years. Okay, so we will go with this, which is why the answer to this question is 2 years. Okay, now why the other option 6 months is sitting at a very lower age or below the recommended first episode window. Okay, so 12 months 1 year also Ahuja's first episode, but the exam answer favors fuller 1 to 2 years course. Okay, 5 years as per both Ahuja, indefinite period or repeated episodes, and Kaplan multi-episode. Okay, so this multi-episode is problematic. Okay, so if this patient had multiple episodes, okay, multiple episodes, then the answer would have been 5 years. Okay, this is worth noting. Okay, so if the multi-episode factor was mentioned, then 5 years would have been the better option among all the options. But since it is not there, we will stick with 2 years. Okay. So remember, the standard duration of antipsychotic in schizophrenia is considered to be 2 years. Okay, this might get again asked. It's little bit controversial, but I would not say it's not that much controversial, because in practice this is what we usually follow for 2 years. Okay, even the patients and their family members are also psychoeducated regarding the duration of antipsychotics in schizophrenia. The standard duration of antipsychotic in schizophrenia is usually around 2 years of age, like sorry, 2 years of duration, where the symptoms are minimal or relatively well controlled. So it's not like 2 years from the start of having an episode. It's basically 2 years of the disease under control. Okay, so that should also be reminded. So it's 2 years of symptom control. Not onset. Okay, not from onset. Okay, so this has to be remembered, because this might also be a question, like whether the 2 years is from onset or 2 years is from the symptom control. Okay, so if the answer would be from symptom control, it has to be 2 years. Okay, so thank you. We will meet in the next section.